How does frontotemporal dementia differ from Alzheimer's? When we talk about dementia, two common types often come up: frontotemporal dementia and Alzheimer's disease. While both fall under the umbrella of dementia, they have distinct differences that are important to understand. Let's explore how they differ in terms of brain areas affected, age of onset, symptoms, and progression. Frontotemporal dementia primarily impacts the frontal and temporal lobes of the brain. These areas are crucial for personality, behavior, language, and decision-making. In contrast, Alzheimer's disease mainly starts in the hippocampus and entorhinal cortex, which are key for memory and learning. As Alzheimer's progresses, it spreads to other regions, affecting language, spatial awareness, and reasoning. Another significant difference is the age at which these conditions typically develop. Frontotemporal dementia usually occurs between the ages of 45 and 65, making it more common in younger individuals. Alzheimer's disease, however, tends to develop later, often after the age of 70. The early symptoms of these two types of dementia also vary. Frontotemporal dementia often begins with noticeable changes in behavior and personality. Individuals may show signs of apathy, poor judgment, or socially inappropriate actions. Alternatively, Alzheimer's disease usually starts with memory loss, particularly short-term memory, and difficulties with spatial orientation, like getting lost in familiar places. Memory loss is a hallmark of Alzheimer's, especially in the early stages. In frontotemporal dementia, memory loss is less prominent initially. However, as frontotemporal dementia advances, memory issues can arise, but they are typically accompanied by more severe language and behavioral challenges. People with Alzheimer's may struggle to find words or remember names, but often maintain better comprehension and speech fluency early on compared to those with frontotemporal dementia. Behavioral and psychiatric features also differ between the two. In frontotemporal dementia, behavioral changes appear early and often include impulsivity and apathy. In Alzheimer's, behavioral changes such as delusions and hallucinations usually occur later in the disease progression. Frontotemporal dementia has several subtypes, including behavioral variant frontotemporal dementia and primary progressive aphasia, which is characterized by progressive language impairment. Genetic factors play a role as well, with about 30% of frontotemporal dementia cases showing a strong family history. Alzheimer's has a less direct hereditary pattern, but certain genes, like APOE4, can increase the risk. Both conditions are progressive and currently incurable. Treatments for Alzheimer's can modestly slow progression, while frontotemporal dementia treatments focus on managing symptoms, as there are no disease-modifying therapies available. Early and accurate diagnosis is crucial for tailoring care, as misdiagnosis can lead to ineffective treatments. In summary, frontotemporal dementia and Alzheimer's disease differ mainly in the areas of the brain affected, the age of onset, and the types of early symptoms experienced. Understanding these differences is vital for diagnosis and management, helping to provide appropriate support for individuals facing dementia and memory loss. Always consult healthcare professionals for personalized advice and treatment options.